So if you've had a C-section and you're not liking the way your scar's looking, or maybe you're experiencing bladder frequency, low back pain, or deep thrusting pain with intercourse after having had your C-section, learning how to massage your C-section scar and free up that scar tissue in there can help you avoid, heal, or change the look of your scar. And in this video, we're going to show you exactly how to do just that. Hi, my name is Lynn Schulte. I'm a women's health physical therapist at Intuitive Hands Physical Therapy in Boulder and Denver, Colorado. And today we're going to be talking about how to massage your C-section scar. But before we do, I just want to make a couple of points here. One is that no matter how long it's been since your surgery, you can still massage your scar and still get the benefit from massaging your scar and preventing those three conditions that I talked about earlier: the bladder frequency, low back pain, and the deep thrusting pain with intercourse. So doesn't matter how long it's been since the surgery, go ahead and massage your scar. Now, if you've just recently had your surgery, you do want to wait until the scar is well healed before you start manipulating right directly on top of the scar. If you've just had your surgery and the scar area is painful, you can work around the scar area until that scar gets healed. So you can do these techniques around the scar to help if you're having any tightness or pulling or pain in that general scar area. You can work around it. Now, know that you want to put as much pressure as you will tolerate. You don't want to be creating a lot of pain, although you do want to have pressure and some tenderness. There might be some burning feeling as you're releasing this tissue in there, and that's okay, but you don't want to be creating too much pain in your body. When you create that pain, your body reacts and tightens up, and it doesn't relax and release. So know that you want to give it some effort, but you don't want to do too much where your body's fighting you. So we're going to talk about this area having 3 different layers. There's many more layers than that, but we're going to simplify things and just talk about 3 layers of how you can release the C-section scar. If your scar is newly healed, you will want to work above and below the scar, and you're going to move the tissues up and down and side to side, looking for the tissues that don't want to move in a certain direction, holding it in that direction until you feel it release. Then you can do little circles, moving the tissues around the scar in little circles, working from one hip bone to the other hip bone, working the whole area around the scar. Then once your scar is less tender, you can put your fingers right on top of it and move your fingers like you're playing a piano, seeing what area of the scar does not want to move and then focusing in on that area. Then you work the scar as a whole, moving it side to side and up and down. The last thing you want to do is to pick up the scar between your fingertips and try to roll it. This releases the skin from the layer below it. To work the second layer, the muscle layer, put your fingers directly on the scar and allow it to sink in until you can feel the muscles below your fingertips, working the area up and down and side to side, and holding the area that doesn't want to move in that direction until it releases. To access the third layer, it's very important for you to bend your knees up to allow you to sink in deeper into the tissue. You put your hands on the scar and you sink in as deep as you can, doing the same movements of up and down and side to side. Again, seeing what area doesn't like to go that direction and focusing in on that area. Also, cup your fingers and allow them to sink down on either side of your pubic bones. Again, doing those same motions. Really try to lift the organs up and hold it there and then move it side to side, checking for what area doesn't want to move and working in that direction. So there you have it. That's how you massage your C-section scar. It's very important that you get as deep as you can with that third layer, because that's where all those issues can arise, is when that bladder and the uterus are not freed up. So the third layer is the deepest layer and the most important. So make sure you try to sink in as deep as you can on those tissues. Now you want to make sure the left side gets as free as the right side and that those tissues are able to move freely side to side and up and down. You want to work on this scar about maybe 5 minutes a day. Do it right before you lay down and go to bed. You can work on that scar and release it. And once it feels released and you check in and it's staying released, then work on it once a week. And then if it's staying released each week, then you can check in with it once a month. Scar tissue forms for up to 2 years, so you want to continue to release your scar, at least check in with your scar once a month until you get to that 2-year mark, and just make sure things are staying loose in that area. So there you go. That's how you take care of your scar, and good luck with that. If you have any issues or any problems, or you're just not able to get in deep enough yourself, please reach out to me or find another women's health physical therapist in your area. They should be able to help you out. All right, good luck everybody. Thanks for watching.